hospital and sick that you're transporting. Their employer, okay? Probably want to consider shutting down the building so that if there's a residual left, nobody else is exposed. Law enforcement, okay, absolutely. They need to be notified. Whether you go through your local law enforcement, okay, to call the FBI or the FBI directly. If this is an intentional attack, FBI is the lead law enforcement agency, okay, for investigation of this. And then one other group you probably should consider calling is your local public health agency, because they're the ones who are going to do the investigation for epidemiology and tracking of exposures, okay? So what precautions should you take in dealing with these victims? Respiratory protection and standard body substance isolation, okay? Why respiratory protection? Yeah, because if this is plague and these guys are fever and they're coughing and they're hacking in your face, okay, the last thing you want to do is be the next victim, okay? If it's anthrax, doesn't matter, you're not going to get sick from them. But if it's plague, they can pass it on to you. Last thing you want to do is become another victim, okay? So use the appropriate precautions, okay? All right. A national basketball championship is about to begin. Fans from Section A start running from their seats. They are coughing, rubbing their eyes, appear to be choking. They trample a bunch of people on their way out. 911 is called, okay? All right, you got the call saying this is going on over here at the arena. What do you want to do? What should you do as a responder? What you want to do is totally irrelevant. Let me repeat myself. Okay, so number one is you want to get the facility evacuated, okay? So, you may communicate with the personnel inside there to be sure everybody's getting out, although once the stampede starts, it doesn't take much for everybody to join the stampede, okay? Well, we haven't decided yet what it is, okay? So we'll talk about that in just a second. Well, let me ask you that question. What kind of agent do you think it is based on those symptoms, since you brought it up? It could be one of the tear gas, pepper spray sort of things. It could be that, absolutely. What else could it be? And again, our job as responders is to think, what's the worst case scenario? Okay. Tear gas, pepper spray, not a big deal, okay? There's things that are worse that I would be worried about more. Chlorine could be a possibility. Ammonia could be a possibility. Those both could be causing these symptoms, okay? What else could be causing these sorts of symptoms? The nerve agents, well, let me back up for a second, okay? Coughing, rubbing their eyes, and choking. Nerve agents, possible, but I think it's a little lower down on my list, okay? A vesicant, absolutely. Which one in particular? Why not mustard? That's got the delay in presentation, 4 to 6 to 8 hours. So which vesicant presents immediately? Lewisite, okay? That would be the one vesicant that would be immediate. Now, let's talk reality. Okay, most people don't have access to lewisite, okay? Now, a terrorist might have access to it, but most people wouldn't have access to lewisite. On the other hand, pepper sprays and those sorts of things all the time, okay? If it was ammonia or chlorine, okay, most people would detect that smell and probably tell you that when you finally contacted, people coming out of there, okay? Where do you set up triage? outside someplace. And if it's a typical arena, you probably have multiple exits, multiple doors of people coming out. Okay, so you may have to have multiple triage areas to evaluate people. Okay, those who are not sick, you can probably let go. Those who have signs and symptoms, you might choose to funnel them to a single area. Okay, if you decided you were going to do decon, where do you do that? Yeah, somewhere outside as well. The victims are complaining of shortness of breath, cough, eye and throat irritation, and burning skin. What chemical are they? You already answered this question, okay? What clues would help you decide what agent was involved? Well, this is a case where the nose of the victims might help you. Pepper spray has a smell to it, okay? Chlorine has a smell to it. Ammonia has a smell. They may be able to tell you that, okay? Some of the others won't have anything else, okay? Since you, in many cases, won't positively identify the agent, how do you want to treat these people? Gross decon for those that are symptomatic, okay? Well, yeah, the lotion that we talked about, actually, didn't list ammonia, chlorine, pepper sprays, etc. Vesicant, it might.
Isn't a big indication, like if they're removed from the environment and they're starting to get better, then that's a big indication of what you're dealing with?
Absolutely. It's an indication that this is just a vapor exposure. So, yep. Any medications and antidotes necessary? O2 maybe, depending if asthmatic. What? Okay, if it turned out to be lewisite, we have an antidote for that. Okay, British anti-lewisite, BAL. Otherwise, treatment for all of these others, ammonia, chlorine, all of the riot control agents, most of that treatment, the supportive care and time. Okay. Let me mention to you, I gave Chief Baldwin a thumb drive with the following reference books on it. There's a series of handbooks that the military prepared that are quick reference guides that are really nice to have. These are downloadable onto your computers. And I also gave him the textbooks of military medicine on biochemical and radiologic warfare. You know, if you need trouble sleeping some night, these are good books to take a look at. And I would assume you already are aware of this, but there's a smartphone app called Wiser that has a tremendous amount of information on all of the hazardous materials type stuff. And it's a good app to have on your phone if you don't already have it. So, questions?